Namaskar and welcome to our special series on Eye Matters Daily. Did you know that glaucoma is one of the leading causes of irreversible blindness? It is estimated to affect around millions of people in our country. And what's more concerning is that most people don't even realize they have it until significant vision loss has occurred. Today, we'll be talking to an expert to understand what glaucoma really is and why early detection is so crucial, and how you and your loved ones can take simple steps to protect your vision. So let's get started and shed some light on this silent thief of sight. Doctor, recently I've been hearing a lot about glaucoma and how it silently leads to blindness. Can you help us understand what glaucoma really is and what are the most common risk factors leading to glaucoma?
Thank you, Huma, for inviting me here. Glaucoma is often called the silent thief of sight because it damages the optic nerve slowly and without noticeable symptoms in the early stages. The nerve is crucial for vision, and once it's damaged, the vision loss is irreversible. Now, the most important risk factors includes the increasing age, uh, family history of glaucoma, high eye pressure, certain medical conditions like diabetes or hypertension, long-term steroid use, and conditions like high myopia. Now, that's why regular eye checkups are very important, especially after the age of 40, even if you don't have any symptom.
So if I'm diagnosed with glaucoma, what are my treatment options and will I need surgery immediately or are there any alternatives? Also, does the treatment differ from the type or the stage at which glaucoma occurs?
No, not everyone with glaucoma needs surgery right away. In fact, most patients initially are managed with eye drops that help reduce the eye pressure. If needed, oral medications or laser therapy may be used. Uh, Surgery is usually considered if these measures don't control the disease effectively. The treatment plan depends on the type of glaucoma, whether it is open angle glaucoma or closed angle glaucoma, and also on how advanced it is at the time of diagnosis. The key is early detection so we can start with less invasive treatments.
I've also read somewhere that there are certain simple signs like eye pain or increase in spectacle number that could be the early signs of detecting glaucoma. Can you help us understand these symptoms better?
Homa, this is an excellent question because glaucoma is tricky. In most cases, especially in open angle glaucoma, there are no obvious signs in early stages. Vision loss happens very slowly, and that's why uh, regular eye checkup are so important. However, in some cases, especially in acute angular glaucoma, people may experience severe eye pain, headache, blurred vision, halos around light, nausea, or even a sudden drop in vision. A frequent change in spectacle power isn't a classical sign, but could sometimes hint at eye health issues. So it is best not to ignore any sudden or unusual changes in your eyes.
Another question I wanted to address today, are there any other comorbidities like diabetes or hypertension that could lead to glaucoma? And are there any precautions that one can take?
Yes, having diabetes, high blood pressure, or other systemic illnesses can increase your risk and make glaucoma more difficult to manage. These conditions can affect blood flow to the optic nerve and worsen the damage. The best precaution is to keep these diseases well controlled with regular eye checkup, a healthy lifestyle, and medications if advised. Uh, Most importantly, your eye doctor tells you about all your medical conditions so that your glaucoma treatment can be tailored accordingly.
And lastly, could you address a few myths about glaucoma?
Of course, One common myth is that glaucoma only affects the older people. In fact, it can occur at any age, even in newborns. Another myth is that if you don't have symptoms, you don't have glaucoma. Unfortunately, glaucoma can progress silently without pain. Some people believe that once treated, glaucoma goes away. Now, the truth is, treatment can control the disease, but it cannot cure or even reverse the vision loss. That's why the regular follow-up with your eye doctor is essential to keep glaucoma under control and preserve vision.
Well, we hope this conversation has helped you understand glaucoma a little better and why regular eye checkups are so important. Remember, early detection can make all the difference in protecting your vision and your loved one's eyesight. Share this episode with your family and friends. Let's spread awareness about glaucoma. Until next time, take care of your eyes and stay healthy. For more information, follow us on @iMattersDaily. Thank you.